All right. Hi, everyone. My name is Emma Dubiz, and I'm the president of the Pharmacy and Health Profession Student Government. So, on behalf of my team, as well as our four speakers, thank you all so much for coming and for being with us today. As you probably all saw from the emails that you've been getting from us, our topic of conversation today is going to be burnout prevention and navigating imposter syndrome. We are so lucky to be joined by Dr. Seaman, Dr. Widhelm, Dr. Powers, and Dr. Wadas-Thalken. So thank you guys so much for being here. All right, so there will be time kind of in between each speaker to ask questions, but then if you aren't able to ask your questions, we will have time at the end. As well as in our email, we said there are 3 clubs that are offering their members volunteer hours, and that attendance code is at the end of the PowerPoint. So please make sure that you stay and watch that. Jordan, our amazing secretary, will also be sending out this video as well as all the information from our speakers so that you can have that for later and then watch it later as well. Okay, so our first speaker is Dr. Widhelm. She is an OT faculty, an occupational therapy faculty member. She's also one of my professors, so I'm excited that she was willing to speak. She unfortunately was not able to attend in person, but she was able to record something for us. So I'm just going to go ahead and share my screen.
Hello, I am Dr. Kylie Widhelm. I'm in the occupational therapy department, and I am on our clinical education team. And so I help advise a lot of our occupational therapy students as they go out on their fieldworks. I also have a unique perspective because I actually am a fieldwork educator, and I still do some practice at a homeless shelter. And so I get to talk to you a little bit about transitioning from the classroom to clinical practice, but also how to stay balanced and healthy while you're caring for so many people. And one of the first things I'm going to say is you can't pour liquid out of an empty cup. If you are truly not filled up with self-care and good things, it is impossible for you to pour that out in clinical practice. And the way to do that is from self-care. And some of the other people on this panel are going to talk about some self-care strategies and preventing burnout, but that is my number one piece of advice, that you can't be a good healthcare provider if you're not taking care of yourself. And sometimes we are the worst at taking care of ourselves, but you've got to prioritize self-awareness, setting up boundaries, creating a personal wellness plan, things like that. Staying connected to people. Sometimes when you're going out in clinical practice, and especially on your clinicals, you may be totally by yourself and you may not know anybody. So use those evenings, go on walks, take your phone, talk to people and stay connected. Stay connected to your support system as much as possible, because those are the people that can call you out and say, hey, it looks like you're not doing as well. Are you really okay? In a process. And there's a lot of things that I've experienced working in trauma ICU and working at a homeless shelter that's heavy. It's traumatic and it's traumatizing for us healthcare providers. And you need some safe places to be able to process some of that information. And doing that from a HIPAA compliant way with a good support system is a way to take care of yourself. And also within that, you want to engage in activities that recharge you, whether it's movement or journaling or having some quiet time or things like that. So make sure you're doing activities that fill up your cup, that don't drain your cup out even more. So take care of yourself, prioritize your well-being, not only your physical health, your spiritual health, your emotional health, your intellectual health, your social health, your environmental health. All of those areas are really important to be really healthy and have a full cup so you can pour it out with the people that you're going to see every day. My next piece of advice is embrace the learning curve. So many of you guys are going to go out into your fieldworks and you're going to say, okay, I think I know this, but I'm not sure if I know it enough or if I'm doing this right or not doing it right. And then you get feedback and it's just a lot. So just embrace the learning curve. You don't have to know it all. You don't have to be perfect. You don't have to know everything. Clinical practice is where the theory and the classroom meets reality. And sometimes reality is not what the book makes it appear to be. So it's okay to not know everything, but be willing to learn, be willing to ask questions. Of course, I'm going to have to say it, reflect on what goes well and what you could do better. Every patient, every opportunity, every experience is not an obstacle, but an opportunity to learn. So don't just dwell on the past, but really think positively about the future and the opportunity that you're taking to learn. So really embrace the learning curve, embrace that it's okay to not know everything, but practice. We're not going for perfection. Practice makes progress. We can always do better. I still want to do better as a healthcare provider in practice. And so practice makes progress. And I'm going to end my little spiel of remember your why. When you get out in clinical practice, remember why you got into your profession to begin with. On the tough days, you have to reconnect with the why you're doing it. Was it that passion that you saw in a therapist or, a practitioner? Was it what happened because of a family member and how the healthcare team helped your family member? What is it? What is your why that you're doing it? And that's what you really have to dig deep and remember on the really, really hard days. You are intimately getting involved in people's lives in a field that can change people's lives for better or worse, but never underestimate the impact that you can be on anyone, whether it's your presence, your patience, your persistence with them, your motivation. Remember your why. And I always love to just leave every client with a smile. If I could get my client to smile at least once in my interaction with them, that just warms my heart. And so those are a couple little things that I would say. My biggest piece of advice is you can't pour liquid out of an empty cup. So take care of yourself, embrace your support systems, embrace the learning, and remember your why. Have a great day, and thank you for letting me speak to you.
Okay, thank you, Dr. Widhelm, if she was here. I know that is always valuable information. I know that's information that we all know. Obviously, you cannot pour from an empty cup, but in the midst of the craziness of school and clinicals and real life, that can kind of get into the way. So it's always nice having someone to stop us and remind us to go back to the basics, remember to take care of ourselves, and find that balance. So thank you, Dr. Widhelm. And now we will hear from Dr. Seaman.
Hello. Thank you so much for inviting us, Emma, to be a part of your symposium this evening. I'm going to be talking about, it was a really great introduction that Dr. Widhelm started us with. I'm just going to carry us a little bit further into that. How are we feeling about ourselves? And I'm going to be talking about embracing your worth, confronting imposter phenomenon. I am the Assistant Dean for Faculty Development in School of Medicine, and I'm also an Assistant Professor for Medical Humanities. You may notice on my credentials here that I have a doctorate in education. That's my EDD. I have a master's in education. That's my MED. I am not a physician. And so I do a lot of non-clinical work with our learners, with our faculty, with our staff. And so I'm hoping that we're going to be able to bring a lot of that to light today. I do want, okay, I've got to hide this bar, right? That's floating all around. Here we go. Okay, want to make sure that's advancing properly. I don't have any disclosures financially, and I do want to acknowledge my very good friend, Poonam Sharma. She's in Omaha. She's a professor for pathology within School of Medicine, and she's helped put a lot of this work together that she and I have presented to different groups about really embracing your self-worth. So I wanted to mention her. She's got some really great videos, and I'm going to share those resources with you at the end of our time together. So just know that that's where that is coming from. It wouldn't be Creighton if we didn't start with a reflection. So here's a reflection from somebody that I do not know, Tamra Puerto. She's a professional photographer, and she says self-worth is the internal sense that you're worthy of love, that you're worthy of belonging from other people. And it sometimes can be confused with self-esteem. Self-esteem really relies on external factors such as how successful are you, what kind of achievements have you already had, to define that worth. But Tamara is saying you are already worthy. You're already worth something. So embracing our self-worth is a journey. It requires some patience. It requires some self-compassion, like what Dr. Widhelm was talking about, and it requires a willingness to challenge the critic that's inside of us. So I wanted to leave you with that, or start you out with that reflection. And we're just going to dive a little bit deeper into some of the things that Dr. Widhelm was already talking about. Just so you know, the OR and the ER are pretty interchangeable. You're going to see in some of the research that I share with you, you're going to see maybe an OR for imposter. Sometimes you're going to see ER. They're pretty much the same thing. So we use them interchangeably, and just don't get confused by the ending there. But here's where there is a differentiation. Phenomenon. You might hear me say imposter phenomenon instead of imposter syndrome. What do you think the difference is between a phenomenon and a syndrome? Anybody want to come off mute and tell us what you think the difference is? You might want to put it in the chat, and that's okay, but I just can't see the chat. That is not available to me right now. So, Emma would have to help me out, or Jordan would have to help me out if you put something in the chat. Do you think they're the same? Do you think they're different? What's a phenomenon and what's a syndrome?
I'm thinking phenomenon is something out of the ordinary.
Okay.
We also had someone in the chat say, I feel like a syndrome is more of a title, whereas a phenomenon is something that may come or go.
Okay, I like that, come or go. That is really nice. And then syndrome, a title. Okay, some good thoughts there. Here's some different ideas as well to just add on to what you've already said. A phenomenon is just a situation. It's a fact. It is happening or not happening. It's occurring or not occurring. It's being observed to exist, whereas syndrome is more like a group of symptoms which are consistent. They occur together all the time, and it's thought of maybe that you might have a condition set by these symptoms. Now, even though we're going to be talking about some signs and symptoms of imposter phenomenon, what I would like you to understand is that this is not a condition that you cannot get out of. It is something that can come and go. So I like whoever put that in the chat. The come and go part is super important with a phenomenon. So sometimes you're going to hear people say imposter syndrome. You're going to hear them say imposter phenomenon. But let's try to think a little bit differently about it, where it's not something you just always have and you're trying to fight against it, but it's something that can come and go. And we're going to talk about what are those triggers that cause it? What are those symptoms that you're looking for? And what are we going to do about it? So I just want you to think a little bit differently about it. Okay, get your phone. Everybody get your phone. And what I want you to do is go to your photos. Go to your pictures. I have Google Photos, so that's where mine are. I have them on my laptop. I have them I have access on all my handheld devices to get my photos, but it's obviously really easy on a phone. So everybody grab your phone, go to your photos, and what you're going to do is close your eyes and you're going to scroll with your finger. Just scroll, 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 scroll. And when I say stop, you're going to put your finger on a photo. 3, Scroll. 2, 1, stop. Now, make sure it's an appropriate photo, but pull that photo up so that everybody can see it. And I want you to show it to the screen. Everybody show a picture. Show a picture. Those of you that are not showing your video. Oh my goodness, look how fun some of these pictures are. Oh, I love it. Very good. Okay, what I would like you to do with this photo, whether you showed it or not, I want you to think to yourself, was this a time in my life where I felt like my self-worth was really high? I felt really great about myself. I felt like I belonged where I was. I felt like others accepted me. Or was it a time when you felt like your self-worth was a little low? Now, you might not actually be in the picture, and that's okay. Might be a picture of one of your pets, might be a picture of some of your children, might be a picture of a home that you live in or a place that you went. But think about yourself during the time that that photo was taken, because more than likely, you took that picture. And I want you to think to yourself, did I have a lot of self-worth? Was I embracing who I was and what I was becoming at this time in my life? Or was I struggling a little bit? And I'm just going to give a quiet, maybe 30 seconds. I want you to think about that. And I want you to put in the chat on a scale of 1 to 5, 5 being, I really felt great about myself, and 1 being, I don't know that I was embracing the worth that was already in me. Okay, everybody put in the chat. Go. Okay. Oh, we had a couple 5s. We had a 2. We had some 2s, and that's okay. We have a lot of 3s and a lot of 4s. Kind of that middle of the road. Maybe I was feeling okay, but maybe I wasn't totally embracing everything about me and about my life at this time. This is the phenomenon part of impostorism. It comes and it goes. And sometimes we are really able to embrace the self-worth that is in us. And sometimes we're just struggling a little bit. But I want you to keep this in mind. I want you to keep that picture in your mind. We're going to be doing something else with your phone towards the end. So keep that close by you. Okay. What we want to do is we want to understand signs and symptoms of impostorism, and we wouldn't really be doing our job if we weren't going to talk about some practical coping strategies to help us really get out of that impostorism when it comes. Okay, so that's what we're going to be doing during this time. I want to share a story with you. This is a little 3-year-old girl, and her name is Jessica. And oh my goodness, she wanted to be a teacher. Even when she was 3 years old, she wanted to be a teacher. And it made sense that I wanted to be a teacher because a few years later, I was the oldest of 10 children. So it was just natural. Teaching was natural in me. Educating was natural in me because of where I was born. I was the oldest of 10 children. So it kind of made sense that I wanted to be a teacher pretty early on in life. And I became a teacher. And then I became a leader as an assistant principal, as a principal of a pre-K to 6th grade school that had about 800 students. And then I started working at the district. And then I started teaching at MCC and ASU. And about 6 years ago, I got a job at Creighton University. And all along the way, these things that were changing, the teaching that was changing into leadership, and the leadership that was morphing a little bit. I was teaching children, young children in the beginning, and then I was leading them, and then I was teaching adults, and now I'm leading adults. And guess what? Lots of times I feel like I don't belong. I started teaching in kindergarten classrooms and first grade classrooms and third grade classrooms. And lots of times I feel like I don't have the right doctor speak. I'm working with School of Medicine faculty. I'm working with School of Medicine physician residents. I'm working with School of Medicine students. I'm working with other health science learners and staff and faculty. And lots of times I feel that imposterism creeping in because I feel like, I didn't grow up in the healthcare world. I grew up in the education world. Am I an imposter trying to just make do in this world that I'm living in? And sometimes this is what I feel like. I just want to put a bag right over my head and I want to do my job. It's not about not liking my job that I'm doing or the learning that I am doing. It's about, I just don't want to do it in front of people sometimes. I just want to take care of my business, take care of my job, take care of my work, and not have that feeling of, I'm not sure if I belong here. So I wanted to share that imposterism story with you because we all have one, right? There's lots of different ways that it might come to you, but you as a learner or as staff or faculty in the SPAHP health sciences, you may have a feeling when you're with a patient or when you're with other peers that I don't know if I belong here, but I'm here to tell you that you do belong and that you are worth it. Doctors Clancy and Imes did the very first, some of the seminal work on imposter phenomenon. And it was back in 1978. Most of you probably weren't even born, right? And they're the ones that talked about imposter phenomenon, that it is an experience that occurs, that it's not a condition, but it's an experience that occurs. It is not a mental disorder, and it can occur in both women and men. Now, they studied high achieving women, which it is more common. You'll see in some of the research that I show you that it is more common in women, but men are not excluded from this imposterism. Just know there's a lot of different assessments out there. And if we were in person and we had lots of time on our hands, and I would have you take this assessment right in front of us, and you would know what your score is. Very short, 20 questions. It's usually multiple choice. There's self-scoring, and you can find imposter phenomenon assessments all over the place. You don't have to use theirs, but the CIPS is the very first one that came out to just kind of see how much are people experiencing this imposterism. Now, for you, I want you to think about yourself. I told you what I feel like. I feel like I want to put a bag over my head. I don't need people to see me. I just want to do my work. I want to carry on doing the work that I'm doing. But I want to know, how does it manifest for you? What does it look like? And what does it feel like when you feel like you don't belong? You can throw something in the chat or you can unmute. I'm going to give you about 1 minute. Okay, I don't see anything coming. Oh, there we go. Okay, it feels like I'm invisible and I can hide behind keeping my camera off. I want to stay quiet in meetings. Okay, I'm worried about what others are going to think. I'm feeling like I'm out of control. I have some fear of expressing my thoughts. Maybe my speech is a little bit stumbled and I'm trying to compare myself as well. These are all totally acceptable, real feelings, right? Okay, so good. Thank you so much for putting some of those in there. Um, all of these are real feelings that we might have if we feel like maybe we've taken on too much or we're doing something where we feel like we might not belong. Here are some other signs and symptoms. We're not going to go through all of these, and a lot of my slides are going to be reference for you. Emma is going to share these with you after this evening, and you're going to have reference to all of these. And if I have any hyperlinks, you'll be able to just click right on those, right in the PDF. But we're not going to spend a lot of time on all of the different slides. But the very last one on this slide is really manifests itself for me. I start overworking. I start to self-sabotage because I'm trying to cover up any kind of doubt that I might have, and I'm trying to make everything perfect. There's lots of different kinds of imposter phenomenon, and there is no shortage of research either. And I'm not going to get too much into the burnout because that's what comes if we are feeling imposterism. The burnout can come and the fatigue can come, but we've got other people presenting on burnout. So I'm not going to spend a lot of time there, but know that that does come. And what I want you to know about the research is this part right here. In 2020, in the Journal of General Internal Medicine, 62 studies. They reviewed 62 studies, and they found the prevalence of imposter phenomenon could be as high as 56 to 82% in health sciences. You are in an area of study where there is a lot of imposterism. You all of a sudden are meeting with people that have a problem that they want you to solve, and you're not sure if you can get to the bottom of it. You're not sure if there's going to be a correct diagnosis when you're done. You're not sure if they're going to walk away happy or not. And so it starts eating at our self-worth. And those are some of the signs and symptoms, is just not feeling good about ourselves and not feeling like you belong there with the patient. But know that it is very, very high within the health sciences. Now, I want you to take a look. I want you to look at these 5 different types of imposterism: superhero, natural genius, expert, perfectionist, soloist. Look at the descriptions of these 5. These are the 5 main imposter phenomenon titles, and see which one speaks to you the most. When you feel some imposterism, which one are you kind of drawn to? Okay, somebody says superhero, natural genius, soloist. Okay. Okay, somebody says a little bit of all of them. That happens as well, right? That can totally happen. And any of these can sabotage us a little bit in just not being able to do the work that we're called to do because of these. And you know what we do in School of Medicine? It here's here's a question I want you to think about as I go into the next one, that I'm going to specifically talk about School of Medicine. But how does society or culture contribute to this kind of imposter phenomenon? Well, you know what we do? This is actually a picture of some of our students, our residents, our faculty. And on day one, I have actually heard people say to our 120 students, M1s that are sitting there in the classroom, I've heard faculty say, once you put on the white coat, you can no longer be silent. Is that is that culture feeding into our imposterism? You can no longer be silent. You can no longer put the white or the paper bag over your head because now you have a white coat on. So culture and our schooling sometimes can even feed into your imposterism. And so we need to be a little bit better about how we're talking to our learners, how we're talking to our peers. Just some other culture that reinforces imposterism, and even in family dynamics. This can even happen in family dynamics. So I grew up, as I told you, one of 10 children. And we had the same parents. All 10 of us had the same parents our entire life. We went to the same elementary school, all 10 of us. We went to the same junior high. In fact, we even went to the same elementary and junior high that my dad attended. We all had, very, very close similarities of how we were raised. And we all have different levels of how we're treated, depending on if you're the first, if you're the middle, if you're the baby of the family, right? It's just how it is. Family dynamics can add to it as well. So don't feel bad about that. Just say, oh, now I know, okay, why I'm feeling like this and what can I do about it? Also know that there are extra triggers for those that are underrepresented or underserved, or especially in health sciences, underrepresented within our programs. There can be a lot of different triggers that are exasperating even just a base level of imposterism. Okay, lots of mental health that can be happening if we feel imposterism, and there's even some research on that. And I don't want to stick on that too much. Okay, the way we're going to end, we want to talk about the 3 C's model. What are we going to do about it now? We are going to clarify, we are going to choose, and we are going to create. These are your 3 ways of helping you get out of imposterism when you're feeling it. You know what the signs are, you know what the symptoms are. We've already talked about that. So now we're going to talk about what do you do about it. So, how do we clarify? We are going to clarify your own imposter story. You heard me tell my imposter story, and the way that I wrote it down is I put it in pictures. There's lots of different ways that you can share it. Share it with a friend, share it with a spouse, share it with a sibling, share it with peers, share it with a faculty member, however you'd like to share it, or you just write it down and share it for yourself. But clarify it, speak it. Say, this is how I feel like an imposter. So that there's not this feeling of I'm all by myself. When you share it with other people, like when I just shared it with you, I got a lot of responses back like, oh, I feel like I take on the soloist. I feel like I take on the superhero. I feel like a perfectionist whenever I feel imposterism. And so I know that I'm not just by myself, but clarify your story, clarify your triggers and your traps. If there's a trigger for you when somebody says something to you, whether it's a patient, whether it's faculty, whether it's a peer, and it's kind of eating away at that self-worth, and you start to feel like maybe I don't belong, know that that's a trigger. Go back to your story and say, oh, yeah, this is why I feel like this. Just make it clear. That's the first thing you want to do is make this clear and clarify, and how you want to clarify how your narrative is told. Mine, I clarify it by telling it in picture form, and I'm the one telling the story. So then I don't have other people saying to me, well, you're not a physician. You kind of don't belong in school of medicine. They're not saying that to me because guess what? I've already told the story. So that doesn't do anything to me. I've already told you. I feel like I don't belong. So when it's coming from you, then other people don't eat away at that self-worth. Okay? So just clarify it. Write it down, put it in picture, however you would like to do. Then you're going to choose self-care. Those are all those things that Dr. Widhelm just talked to you about filling up your cup, about taking care of yourself. Know what your values are and know how to take care of yourself. You're also going to choose to silence negative thoughts. So as I start thinking about maybe I don't belong in the school of medicine, you know what I start saying? I choose to silence those negative thoughts by replacing it with something else. And that will kind of come into the create part too. But I say, there's some really great physicians out there, but maybe not really great clinician educators. And that's why I'm here to help them be a really great educator. So I silence those negative thoughts by saying, I can really contribute into what I'm doing, and then choose to speak your truth. So I speak my truth in saying, I have a lot of education in education, and that's my truth. And so that's something that I can bring to the table. And then you're going to create your dream team. It might be a great study group. It might be a couple faculty members that you can always go to or shoot an email to or shoot a text to and just say, hey, I'm feeling a little bit low right now. I'm feeling like my self-worth is not where it should be. And I just want to know what I can do better. You know, put that dream team together. It could be family, it could be leaders, it could be peers, but those are the people you want to have around you. You're also going to create a new narrative or a new role. Check out a new role for yourself. Maybe you're going to get into a leadership role within your study group. And maybe you've never done that before. Maybe you're going to speak up when you wanted to be silent. And then you're going to create conditions for optimal performance. And that is showing bravery. I'm going to create a situation where I can be of help to somebody else. That is optimal performance for me, is when I feel like I can be helpful to other people. So I want to put myself in a position where I feel needed and I feel helpful. There are a lot of different studies out there of ways that people have handled imposter phenomenon or imposter syndrome within their programs, but I really love this one, and I just wanted to leave you with this one. There was an implementation of a best self exercise, and this is how they did it. At orientation for all the physician residents, there was 19 is all that chose to participate. So not a whole lot, but for these 19, it really made a difference for them. And this is something we're going to do in just a minute. They had people write something about them when they were at their very best. And what you're going to do is you are going to pull up on your phone a picture of when you were at your very best, when you felt really good about yourself, when you were at a 5 and there was no imposter phenomenon creeping in. Okay. And what these residents did, and we'll do that phone exercise in just a minute, or you can be looking at your photos right now. But what happened was with these residents, whenever they started feeling down, they were asked to go back to the stories that people wrote about them when they were at their very best. And it just reminded them, oh, yeah, I can do this. And this is why I'm here. So this is a way to create a new narrative for yourself. And you can do it with pictures. You can do it with people writing stories about you. You can do it from your own writing as well. Okay. So what I want you to do is find that picture when you were at your very best. Might be a picture of you. It might be a picture of when you were at your very best, a time in your life where you didn't feel any imposterism, but maybe you're not in the picture, and that's okay as well. Okay, I'm giving you 30 seconds. Find it and then show it. All right, everybody, show. I'm opening up my screen here. Show me your pictures. Show me your pictures. I love it. I love it. Good, good. You have these good moments in your life. You have times where you are not out of place, where you do feel like life is going well. Put that as your wallpaper. Put it close in your phone so you can go back to it as you need, because you are the creator of your own new narrative. At the AAMC a couple years ago, one of my very favorite authors and speakers, Brene Brown, said there is no courage without vulnerability. So this is going to be vulnerable, right? Because if we're going to be courageous, if we're going to be brave to get out of this imposterism, we're going to have to be a little bit vulnerable. But she says vulnerability is not weakness. It's the ability to show up, be seen, be brave when you cannot control what the outcome is. Courage requires the willingness to lean into uncertainty, risk, and emotional exposure. Doesn't mean you have to feel imposterism anymore. You might feel a little uncertain. You might feel like there's some risk, and you might feel like you are exposing the emotional side of you, and that's okay. That is courage and bravery. I've got lots of references and resources for you. You'll be able to click on these as you have these slides. And here's contact information for both Poonam and myself. And thank you so much for your time.
Thank you, Dr. Seaman. I think a lot of us can relate to the things you say, and it's really easy to be hard on ourselves, but then allow grace for other people.
I just wanted to touch on a couple of things regarding burnout. And before we do that, I thought I would just start with that, burnout comes when our well-being is really out of whack. So let me show you. I've got so there's a couple of well-being models. One that we use quite often is this one from Gallup with Rath and Harder. So they have a couple, five different aspects of well-being here. And then this is another wheel of well-being, and you can go to this and actually take a well-being inventory and see where you're at. And then this is one that I really like that a faculty friend of mine introduced me to a few years ago. The reason I like it is because it includes the spiritual side, which I think lends itself really nicely to our Jesuit mission. And so the aspects of well-being would be spiritual, physical, emotional, intellectual, social, and vocational. When one of these is either getting too much attention, it means others are not getting the attention that they need. And so we are then out of balance. And so oftentimes when we think about burnout, we think about that work is really what's burning us out. And so the idea of burnout is that our well-being is out of balance, and it means that something is probably not quite right at work. And I always want to remind people that if you were to quit your job, guess what they're going to do the next day? They're going to post that position on the HR page, and they're going to hire somebody else. So I think we all think that we are indispensable, or we all think that we are incredibly valuable. But the reality is that, there's lots of different people that can do our jobs. And so I want you to remember that it's really important that you find a place of work that means a lot to you. And there's a lot, and there's the reason that we've got folks like myself or Dr. Powers or Dr. Seaman who are actually from more education and psychology backgrounds is because we want to help prevent burnout in the health sciences. Now, I could go on a whole tangent where the reason burnout is a little bit more prevalent in healthcare is because of the healthcare system and the hospitals and the medical systems themselves. So I think it's really a systemic problem that now we're trying to like fix the individuals instead of the system. But that's a whole other soapbox conversation. But so some characteristics of burnout are disengagement. When we start to think about like, gosh, you know, that stupid patient again didn't do her exercises and now she's come back for her appointment and she hasn't made any improvements on, you know, the, like I had my wrist operated on. So I'm thinking about like, if I wouldn't have improved, you know, my wrist range of motion or, you know, something. So we start to see our patients and the work as we're disengaging with it and not seeing them as humans. And that's a problem. Distant emotions, feeling helpless, decreased motivation, and then sometimes depression. So, how do we mitigate burnout? I think number one is we need to know, you need to know what's important to you. And I know Dr. Seaman had a great quote from Brene Brown earlier. And so this one is also the idea is that we need to be authentic and be true to who we are. And so I think that when we talk about mitigating burnout, you need to identify, really take some time, and this is a great time to do it as a student. What are your values? What's important to you? Based on those values, what is your purpose as an OT, a PT, or a pharmacist? And then based on those values and purpose, what are your long-term goals? Who do you want to be as a pharmacist, an occupational therapist, or a physical therapist? I've got a handout that I can pass on later to Emma, but each time that you make a decision about your career should go back to what is this purpose and what are your values? What are these long-term goals? Because when you say yes to things, they should then reflect and help you achieve those goals. This also helps us set boundaries at work and at home. And I think that for so many of us, we are like my strengths finder, I think my number two strength is achiever. So I want to do well and I want to be good at my job, but I always have to remember at what cost. And when it starts to impact my mental health, my physical health, my family life, then it's not worth it for me. And when I actually pull back sometimes, I find then that I do better work because I focus on the aspects of work that really matter and are really important. And then I do end up excelling more than I thought I was when I was actually really like trying too hard almost. So that is just a couple of quick comments, and then I'll transition to Dr. Powers. Kevin, do you want me to do your slides since I already have them up?
Yeah, that's perfectly fine.
Okay.
Um, Good evening, everybody. Thanks for the opportunity to come and chat with you. It's always fun to interact with students in ways that are different than just sitting in my office and talking with you, although I certainly love doing that as well. I always appreciate opportunities to interact in a different way. And these topics are great because they're so pertinent and so relevant and I want to say so common, which on one hand is really kind of nice. On the other hand, also kind of sad. Where I'm going to touch briefly on both, which is actually going to be easy because Dr. Seaman and Dr. Wadas had such great comments already. I'm a big proponent of the idea that knowledge is power. So much of the way I orient the work that I do and even around these topics is being knowledgeable about them. And that's not me saying being an expert in them, right? I put this particular cartoon on this particular slide because when I saw it, I was like, oh God, yes, that's exactly how I'm gonna feel when I'm presenting this thing. Like even the presenter feels like, oh, I probably shouldn't be here. Someone else should be presenting on this. Someone else can do this better. When I say be knowledgeable, I really mean be knowledgeable about what's going on with yourself. As Dr. Seaman mentioned, that with the idea of an imposter phenomenon being this experience that can come and go, it's something that you can observe and be aware of. I think it can be helpful to take a step back and look and go, oh, this is what I'm feeling. This is what's happening right now, and spend some time evaluating it. I think to a certain degree, a lot of these experiences um, can be subjective and influenced by what it is that's going through our mind. And if I'm standing here presenting and looking at this cartoon and thinking, yeah, I shouldn't be up here, it's going to change the way I'm experiencing other people, the way I am taking in information, the way I'm responding in class, how I'm participating, how I'm engaging. And yes, I do tend to think about class given what I do with academic success. So that tends to be where my focus is, but it'll be true in the clinic. It'll be true in labs. It'll be true when you're studying with or and practicing skills with other people. It'll be true when you're interacting with family and friends in whatever other capacity you notice this stuff. Um, and it's, I think it's helpful to remember that with the imposter phenomenon, especially, there is this kind of inner dialogue that's where we're telling ourselves, I can't do this, or someone else is going to do this better than me. Um, and I have there the comment about fixed mindset. If you are familiar with fixed versus growth mindsets, this won't come as a surprise to you. If you're not, I'd certainly encourage you to look into some of the research around the benefits of having a growth mindset. The fixed mindset basically is saying that we have kind of these natural skills and abilities. I have what I have. I possess what I possess. I know what I know. I can do what I can do. And if I can't do it, it's because I don't have the skill. I'm not going to be able to do it. If I don't know it, it's because I don't know it. I'm not smart. As opposed to a growth mindset, which takes those opportunities where we are struggling, where it seems like other people might be doing something better than we are. And we look at those as opportunities for growth, for change, for development. I don't always, if I'm being totally honest, I don't always love to grow because growth is hard. Growth is work, but growth is good. And I know when I look back throughout the course of my life, as Dr. Seaman was reflecting on hers and sharing her experiences, I kind of was doing the same thing. I'm like, oh yeah. Those times where I saw myself dealing with imposterism and thinking about how I responded, when I looked back and saw that as an opportunity for growth and change and development, then I moved. I improved. I was a better version of myself. And so I'm going to encourage you to be mindful of the dialogue that's going on through your head. Dr. Waters, you can move on to the next slide. Um, a lot of these were already covered in terms of how we might respond. I also loved this cartoon as well, just because it just captures it so well. You have everybody walking around thinking that everybody else has it together. And I kind of want to say you all do. You all have it together. It may not always feel like it at every time. But it would be so nice if everybody understood that at times everybody doesn't always feel like they have it together. And that touches on some of the things that you can do to address the struggle with the imposter phenomenon. Share your struggles, share your failures. I would ask, to chime in on where you failed in life, but I'm not going to bother with that right now. Okay. I could ask you to all raise your hand. And if you don't raise your hand, I'm going to go, well, you're probably not thinking hard enough. We've all failed at something at some point. That's not the challenge. That's not the problem. That's not the difficult spot, I think. I think the difficulty is we just don't talk about them. And I think knowing where other people struggle can help us, help normalize that feeling. Letting go of perfection and recognizing that, as we talk about fixed versus growth mindset, making progress and being good enough can really help that sense of feeling like an imposter. I always love the idea of thinking about being good enough. It's an ing verb, right? And ing verbs are things that are actively going on. We're in a process of doing something. Um, it opens up for that opportunity for, again, growth and change and improvement, right? So the things that we maybe don't feel like we're doing well, guess what? That may be true right now, but that doesn't mean that's where it's going to end up, right? You are in the process of doing it, learning it, demonstrating it, performing it. Sharing your feeling with others and celebrating your success is all very good, as Dr. Seaman, touched on earlier. Connecting with other people, building that support helps build connection and collaboration rather than the challenges that come with comparison. And that comparison tends to fuel that imposter feeling. So finding ways to work together and share those experiences. I did love the statistic of 56 to 82% feeling like they don't belong or feeling that imposter syndrome. And I'm like, that's over half. That's most everybody. The logic of that just I found fascinating. And I believe it. I don't think that statistic is lying. But how can the majority of us how can we be successful and not know what we're doing? Right? So you just kind of think about that stuff. And to me, that's relates to some of the challenging distortions. The experience of looking back at our pictures. One of the things that I like to talk about with this is, you take a step back and look at your life's journey, your life experiences, and it puts current struggles or frustrations or challenges in a larger context of um, a number of good experiences, a number of successes, a number of improvements, a number of areas in which we have performed well, demonstrated skills well, really shown in what it is that we're doing. So the more you can be mindful of any of those negative distortions, challenging them, I think can help that feeling of imposter syndrome, the imposter phenomenon. One of the other things I often encourage students to do also is I put accept it. When we tell ourselves to not be something, it's a self-criticism. When we say don't feel something, that's a demand. If I tell you to don't think about a pink elephant, what are you actually going to start doing? I could ask you about all the pink elephants that you're thinking about right now. What I would encourage you to do is, rather than don't think about a pink elephant, do think about a blue horse. Now, if I had more time, I'd be like, well, what kind of blue? What kind of horse? Is it all dressed up for a parade? Is it a big Clydesdale or a tiny little pony or a stereotypical horse out in the wild? A light blue, a dark blue, a midnight blue, a Creighton blue, whatever, right? What we find when you start to think about that blue horse, what happens to that pink elephant? Gone, right? When I say accept it, it's if there's a pink elephant in the room, fine. So be it. But then turn your attention to the blue horse. As Dr. Wadas mentioned, this is why I wanted to touch on both, because I think they kind of tie together. What is your blue horse? What are your successes? What is it that you want to do? How do you want to improve? If you feel like someone else can do something better than you, how can you get better at that thing? Or just from a self-talk, what do we want to tell ourselves instead? I'm worried that my part of the presentation is not going to go well. Nevertheless, I'm going to get on Zoom and start talking, right? It's the idea is rather than fight it, I'm just going to own it. I'm going to accept it. I feel this way sometimes. Maybe I feel that way right now. Nevertheless, I'm going to take a step forward in the direction that I would actually like to go. and then you move. Dr. Wadas, you can move to the next slide. In that same context, as we think about burnout and what it is, I appreciated the World Health definition where it talks about it as, yes, this workplace stress and work, school, family burnout is not limited to one aspect of our life. Dr. Wadas talked about, all the varying aspects of well-being and things being out of balance. I would describe it as just stress related to one or multiple of those areas that we're just not managing well. I added the bold in italics there. They talk about feelings of energy depletion and exhaustion, mental distance, disengagement, the feeling cynical, reduced efficiency. Yes, all of those things. But to me, it's this interaction between characteristics about myself and the world around me, and how am I managing the role that I'm in? And part of that, again, comes back to how is it that I'm interpreting the situations that I'm in? As Dr. Wise talked about, burnout coming when things can be out of balance. I always put an asterisk around out of balance, because oftentimes we think about balance as even, like a seesaw, right? Well, when it's like this, then it's in balance. And I want to tell you, balance between the 8 areas of well-being or whatever aspects of your life you're trying to keep in balance, they won't always be equal. There are times where work demands more from me than my family. There are other times where my family demands more from me than work. There are times where things that I have going on in my personal life outside of family and work take up a bigger piece of my balanced pie. So if you feel like they're not all even, that's okay. I think burnout can come where one becomes bigger than we actually need it to be or want it to. No, I don't want to say want it to be, because sometimes I want work to be smaller than it is sometimes, right? But I think the burnout comes when we're not managing how we're engaging with those stressors well. Dr. Weiss, you can go to the next slide. I think oftentimes I try and help students, and regardless of whatever it is that we're talking about, recognize what are the things that I can control. Burnout can be related to stress in a bunch of different areas of your life. And burnout, if it's related to stress, keep in mind, there are also good events in our life that can cause stress, right? Weddings, wonderful, also super stressful. Moving, potentially wonderful, but like one of the most stressful things that happen in life, right? So be mindful that not only negative events lead to stress. Positive events that are going on can lead to stress, and stress can increase that distress that can lead to burnout. But I come back to, well, what are the things that I can control? Having that internal locus of control helps me build resilience, helps me remember my purpose, my sense of meaning, helps me commit to the things that I am going to try and accomplish. I end up feeling a little bit more optimistic, a little bit more empowered, a little bit more directed towards my goals. Because it reminds me, here are the things that I can control, and I can start to let go of some of the things that I can't. Okay? Related to that, understanding what burnout is and how it relates to stress helps me remember, okay, then I need to identify what some of my stressors are, the good and the bad ones, and decide, how do I want to act? How do I want to respond? And I got to think about all of these stressors. Okay. Some stress is good. So just because you're feeling a little stressed at times, if you are, doesn't necessarily mean that's burnout. Some stress is what keeps us attentive. Some stress keeps us focused. Some stress makes us finish those assignments. Some stress makes us read exam questions more closely. Some stress gets us to study a little bit more. On campus, our campus is cut in middle in the in north-south by 24th Street. And there is a voice that says walk signal to cross 24th Street is now on. For Phoenix students, I'm assuming it's Central, right? Central Avenue. That thing is busy. If I have too much stress, I'm going to look. I don't know. Can I cross? I don't know. It says walk signal to cross 24th Street is now on. But I don't know. What if there's a car coming? I don't know. And I get you paralyzed. I'm not moving. Conversely, no stress. I'm just going to start walking. And on 24th Street, that's not a wise decision. Some stress keeps me alert and attentive and keeps me safe, right? So don't worry if you're feeling stressed. Take some time to step back and evaluate, is this good stress or is this bad stress? Is this stress that's helping me? Or if it's not, what is it and how do I want to respond? Again, connection, always key. We're social beings, and the more support and connection you can have, the better. We've already touched on self-care. Find self-care that takes care of multiple aspects of yourself. Physical self-care, cognitive self-care, emotional self-care, spiritual self-care, physiological self-care. Don't just target one. See what you can do to be balanced in that care for yourself. I have there, in terms of mitigating burnout, stop multitasking. Sometimes we can burn out because we're doing a lot of things. And the reality is we don't tend to multitask very well. We switch tasks a lot. We don't actually multitask. So what I want to tell you is choose. Pick one. Even with the imposter phenomenon, Dr. Seaman mentioned clarify, choose, and create. With burnout, you've got all this stuff going on. I'm trying to multitask and manage all these things. I want to go choose. Pick one, focus your energy there. Go. And to Dr. Wadas' point about, well, what is it that you're doing here? Remember your passions. Why'd you choose what it is that you're doing? There was a reason, probably a good reason. Oftentimes, and it's certainly relevant now, at this time of the semester, during orientation week, I would often ask students, why are you here? What is it you're trying to accomplish? So I want students to remember their why as they start their journey in our programs. But also one of the reasons I ask that question is because I want it in your back pocket at all times, because there are times in the semester, there are times in the program where burnout is staring you in the face. Remembering why you are here and what it is that you're trying to do, who you're trying to become, can help reinvigorate, can help motivate, can help redefine some of that stress. I have, Dr. Wadas, you can scroll through the other slides. These are just knowing the things that we're talking about. I was like, I want to just include a couple slides that have some of the resources that exist for our students. So certainly reach out to them if you feel like they're appropriate for you. But I kind of want to stop here because I know we want to leave some time for questions and any further dialogue that we would need to have.
I have a question. So obviously, all three of you, including Dr. Widhelm, you're in very stressful positions. You are managing a lot of different people and also helping students out with all the craziness that we're going through as well. Is there a statement or something that you say to yourself or something you think about when you're trying to ground yourself when that burnout starts to creep in or when that imposter syndrome starts to creep in? You guys talked a lot about the 3 C's and the boundaries, but is there something specific that you always tend to go back to, especially in like the field you're in?
Yeah, I'll offer an example. So I think Dr. Seaman had mentioned it as well, but have somebody who's a little bit of your support system. So one of my people that I go to when I'm like just questioning myself is Dr. Lou Jensen, and so she's somebody that I can be very vulnerable with and talk through, I'm really nervous about this project. I don't know if I can do it. So she's somebody that I go to. So I think knowing who your cheerleaders are, who can help you be successful and remind you that you are capable is really important.
I was going to say something very similar. Don't be silent. Don't keep it to yourself. Make sure that you have chosen your dream team. It might only be one person that is your dream team. And late at night, after we've kind of put the house to bed and our teenagers are calming down, and I talk to my husband and I just say, hey, this is what's going on. I'm not sure if I can do it. And he, just that one person can be my dream team. Now, if it's somebody professionally here at work, I just try to not keep everything to myself. It's okay to be vulnerable, be brave, be courageous in just saying it out loud. I was in the elevator the other day and I was talking to a PA student, and he and we don't know each other really well, but I had taught I had taught a session in one of their classes for medical humanities. And so he knew my name and we were just visiting, and I said, how's it going? And he said, Dr. Seaman, I am just slowly dying. And just for him to just say that out loud, then I could support him just in the elevator ride. I could support him in a little bit different way than just staying on the surface. Now, it doesn't mean you have to spill your guts to every single person, and that's not always going to be helpful. And you don't always have to say the negative, but you have somebody that you can just say something out loud to. And if that is going back to maybe a journal or a notepad where you're just writing things down, just don't keep it all inside.
Um, I'll add, I would agree with both of them. Um, I've talked to friends, I've talked to family, I've talked to therapists, like all of it is just having somebody to voice things to. Um, I'll share just two other things, and this is part what I will kind of tell myself to manage the stressors, and then how to actually then move from them. The thing that I will often tell myself is this too shall pass. Because sometimes the stress is greater when I feel like, oh, this is never going to change, this is never going to get better, and it's all transient things. So this too shall pass, and that's also true of the good times. Um, and the last thing I was talking about in terms of accepting it, I will own stuff. I will do that. And just say, yep, this is what I'm feeling. Yep, this is what's going through my head. And great, now this is what I'm going to do. Time to move.
Thank you, guys. Does anyone else have any other questions? All right. Well, thank you to our speakers again for sharing your knowledge with us, your tips and tricks, for hopping on a Zoom after a long Thursday, for everyone as well watching synchronously, asynchronously. Thank you all for being here. I am going to share my screen again so you all can get the QR codes. Jordan is going to send out this recording as well as all of the information that our speakers shared. Once again, thank you so much to our speakers for playing email tag with me for the last 2 weeks and just for, again, coming and sharing your knowledge and asking questions. And we really appreciate it. So thank you guys.